Tinel's sign. Okay, so Tinel's sign is basically a provocation test. Again, you're trying to reproduce symptoms, and this is about reproducing symptoms in a nerve. So where you've got somebody complaining of nervy type pain, so what might they complain of, do you think? So I can't hear you all talk at once. That was very good, I'm sure, yes. Tingling, shooting, radiating, numb, electrical pain, all of those kind of symptoms they might well complain of. And what we're going to do here is we're going to look at the calcaneal branch of the tibial nerve, which is going to be important when you come to look at things like plantar fasciitis and medial ankle pain, because it starts coming down the medial side and just behind the medial malleolus, and it branches off and goes underneath. So it could be confusing pain with the tibialis posterior, so that's the medial ankle, but it goes underneath the heel as well. So it could be confusing pain associated with plantar fasciitis, that kind of thing. So if I just do this one, you need to have your patient very slightly externally rotated so you can get to it. And you're going to find the midpoint between, so I'll just show you guys as well, the midpoint between the apex of the heel, which is the point of the heel if you like, and the medial malleolus. Okay, so about there. Okay, about there. So when you found your point midway, you're going to percuss it. Now percussion is something we haven't done a lot of because it tends to be more something you do on a chest if you're looking for pneumonia and that kind of thing. But we're going to use percussion techniques. Normally with palpation we use the rounded flats and we use little circular movements, don't we? Yes, Emma? Yes, we do. This time we're going to use more of a claw-like approach, like that, and hammer. So you're going to use a light percussive hammering technique. So brace your fingers, those two fingers, into a hammer claw-like approach, and then hammer down like that. Okay, so I'm going to just get the patient, if you have, you basically need to have your nerve quite prominent, so you can only do this on a superficial nerve. That's something that's important to say. This one is quite superficial, but if you get them to evert, you'll make it even more prominent, if you like, and easy to access. So what I'm going to do is get her to evert as she is, find my midpoint and just percuss. Okay? That's fairly firm percussion, but it shouldn't be painful. She's not convinced. And you can move around the area, because obviously anatomical deviations are normal. Okay? Now the thing to remember is if you've got long nails, you'll need to cut them before doing this, otherwise you're going to lacerate your patient, and that won't be pleasant for anybody involved. So make sure that you're using a firm percussion technique but with short nails. Okay.
What should they feel? What should you?
You're going to reproduce their symptoms, so it's a provocation test to reproduce the symptoms that they complained of originally. Now it's important that when we talk about provocation tests that we make that distinction, because another one we're going to do will later on the slump test, you'll often find a false positive because they complain of pain, but it's not their pain, it's not the one that's brought them through the door.